Dr. Soin, let me begin by getting your take on the 1 million mark. Now, some say that this is very worrisome. Is India poised to even beat Brazil? We're already the third largest in terms of numbers of cases, and the curve doesn't seem like it's flattening. The other take is that, hey, don't look at the 1 million number. Look at the mortality rates and the recovery rates. And if you look at that per million, we're not doing too badly for a population our size. How would you break down the data?
Tamanna, I agree that 1 million is a scary sounding number, and it's a landmark we really didn't want to reach. But actually, the fact is that I don't think there are 1 million cases. There are probably 20 to 50 times the number of cases in India. So we probably, considering our population, we are probably ahead. We are at number one in terms of the number of cases. So I don't think we should actually be looking at cases. And I agree with the second viewpoint which you gave, which is that the encouraging part is that the mortality of COVID infection in India and in general is now lower than what it used to be 3 months ago. So if you look at 26,000 deaths in 1 million cases, you're looking at approximately 2.5%, right? So also, I think that we've learned to treat COVID better. So people who are hospitalized, who have moderate and severe disease, we're able to manage those patients better, so the mortality is coming down. And I also believe, and I don't really have strong scientific data to prove that, but I'm a practicing clinician and I work in a hospital where we have 150 COVID patients being managed by our ICU and infectious diseases team. I feel that the virulence of the virus is also coming down. So those are the silver linings in the otherwise worrisome figure of 1 million or perhaps much more.
Yeah. You know, I think we, of course, need to look beyond just the numbers at how we are handling it. It is a landmark which requires us to understand what happens next. Are we looking at this going on increasing till the end of the year, till early next year? I mean, there's an MIT study which says that by next year, India is going to be worst hit. Before I come to Dr. Thakkar, I want to go to the numbers, man. Dhruba, how do you look at the 1 million mark? And I know that at Protivity and at Times Fact, we look at the active cases, just like the health ministry is pointing out, that is actually 3.42. But I understand that in your worst case scenario, this could also go up as high as 6.5 lakhs.
Right. So what we are looking at is, we are looking at the numbers change closely, right? When we started the exercise, we were on a lockdown, so it had its impact. So on the unlocking, we see that the cases are rising and rising rapidly. Now, the reason, if you see it's rising, it's not that Mumbai or Delhi is doing badly. It's a number of states and cities have started to kind of increase in the numbers. So yes, we are looking at the numbers closely. We are seeing that the spike is much higher than it was initially. And it's because the epicenter is changing and there are multiple points where these numbers are rising and rising very fast. The only concern I would say in this entire thing is, if it rises too fast, it puts a kind of a stress on the healthcare system. Otherwise, as the guest is talking about, yes, our mortality is on the lower side, our recovery is on the higher side. So we are able to keep a bay on what the active number of cases are. So that's a good sign. And if we can keep a control on the rise, we would see our recovery grow up even more, right? At 65%, around 63% where we are, I think as the time progresses, our recovery rates will also increase.
You know, on recovery rates, Dr. Hemant Thakkar, I want to come to you on this. And of course, your view on the 1 million figure. On recovery rates, some of the experts I've spoken to, and I've had an opportunity to speak to many, say that a 60-70% recovery rate is not something to really be celebrated. Because anyway, generally, it's hoped and expected that 90% of people who get COVID recover. How do you look at the conflicting sort of breakdown of the numbers that we're seeing?
I think I agree with you and the experts who said that, because out of 100 COVID patients, 85 to 90 are going to recover asymptomatically without any help. They don't need anything to be done for them. It's the remaining, and that's where I agree with Dr. Soin, that we are now anticipating complications. We now are thinking on our feet. We know how to use this new array of drugs that we have. We don't give every patient Dexona and Remdesivir and Favipiravir and Itolizumab. We know which one needs what. So since we do that, patients are now getting more confident. They're being treated at home with more confidence, and they know when to come to hospital. So we are interjecting their progress with the correct kind of medication. So our mortality rates are coming down. We are handling these patients better. Now, I don't think that the recovery rate has to be seen to be celebrated. It is the reduction in mortality rate that needs to be celebrated. And as you test more, in a lockdown, you had rationed testing. The stringent norms that you had for testing people were like a ration card or like a customs immigration form. Now that people are allowed to test as much as they like, you're going to go up in numbers. And I agree with Dr. Soin that 1 million is only the tip of the iceberg. You have 80% of the iceberg below the water. So a lot of more positive people are there. But the fact that they are there and they haven't come to hospital and they haven't have become symptomatic is something which we need to celebrate about. And this virus, we have to combat from the point of view of mortality rate alone, and not the numbers of how many there are. They're going to increase. Whether we cross Brazil or USA doesn't hurt me. We have a population that has overcome and overtaken Brazil and US. So that's going to be positive. We live cheek by jowl. We travel shoulder to shoulder. So all this is going to increase our numbers. I don't think we need to worry about those kind of numbers. We really need to worry about saving them, mortality rates, less hospitalizations, and less stress on healthcare.
So that's the important part now, and I think that's the part we should come to, which is testing. Are we still testing enough? And you are right, Dr. Tucker, when you say that testing has now been freed up. It's not rationed like before, but it is still prohibitive in cost in a lot of places. It's not still easily accessible all over. So when Dr. Soin says that the real numbers could be much larger, is that a function of less testing than we should be? If you look at the per million parameter, India still ranks pretty low.
So I'll give you an example. I have families where one person tests positive. He isolates himself. They have a 2-bedroom house and there are 4 of them in the house, and he isolates himself. And 3 or 4 days later, while they're being treated at home, the relatives come and call and say, "Sir, should we get ourselves tested?" And now our verdict is, if you're not symptomatic, don't bother to test. You have to look whether you developed antibodies, and you can look at that after 14, 15 days. So the cost of testing, which is apparently prohibitive, is non-existent if you know when to test.